Hello and welcome to the Sikkim podcast brought to you by Summit Times. I'm Tshering Eden.
And I'm Pema Wangchuk.
Today we thought we'd start it a little differently, the podcast. And we'll start with a few questions that we have. We have not been told how the spread in Chanatar and Mamring happened. We don't know.
From where the virus first arrived there before everyone got infected, right?
Yeah, because it clearly has become a super spreader
Event.
Of sorts. Yeah. We have not been told how many paramilitary forces have been infected till date and how many people have been infected from these two events, from these two death rituals.
At Mamring and Chanatar.
Yeah. What we're saying is we haven't been told the breakup. We have our own calculations, according to which I think the Chanatar and Mamring death rituals must have contributed. Now, I think it is over 300 infections, 300 patients.
Mm-hmm.
And the paramilitary forces close to 200, which is like 500. And
which is most of... How many do we have?
We have right now 829.
Cases.
Not right now. The cumulative cases so far is 829. And in the initial phase, we just had the returnees testing positive mostly, for a month or so.
Yes.
So it is obviously more than half, almost the contribution of these two events and paramilitary forces.
Yeah, I mean that's clearly there, right? 500 something it works out to, and you have a total of about 800. That's about 60%.
Yeah.
Of these cases from this
we have also not been told how some of the isolated cases happened, like the Dikchu patient, a patient from Dikchu who was tested positive for COVID-19. We still haven't been told how that person got the virus.
Mm-hmm.
We haven't been told how the STNM emergency ward doctor got the virus. We haven't been told how the Bojogari vegetable shop employee got the virus.
At least in that one, there's a theory, right? The health secretary did throw a theory that he could have got it from the drivers, those trucks bringing vegetables from Siliguri. So at least there's a working theory.
Yeah. Of the other cases, there is absolutely no mention till now, like how it could have happened. So there are many more questions, but we'll stop at that. These are the three.
I mean, there is that. The main big question, like, why are we like this? But but these are the primary issues.
The most primary being the Chanatar and Mamring cases. Like there is nothing, no word from the health department till now about how these infections could have. There's been absolutely zero mention of how, theory also be.
Yeah, there's not even a working hypothesis on this. And I think I've been thinking about this, right? And I think that is how, at the national level we are looking at these cases, where you have an outbreak and you have an incident, right? You have an outbreak or whatever. And then the contact tracing focuses on, let's say, the first positive patient you detect from a particular area, and then that person's contacts are being traced. And that takes up so much of your energy and resources that not enough thought has been not enough investigation, let's say, right, goes into how did this person contract the virus. So when you talk about the Chanatar and Mamring episode, for instance, it came to light only with a person from Agriculture Department testing positive.
Who was not the source.
Who was obviously not the source, right? She probably contracted it when she went to that function. And then the entire focus was about contact tracing from there on, right? And like you pointed out, we don't know how the virus reached there.
And there is also a possibility, we are focusing on, even on social media. The world is living on social media right now. So even in our news, we get comments like these two funerals have really screwed things up and all that. But then last time you were also mentioning how we could be wrong. Maybe it is not these two funerals that were the source.
No, I think
it could be the Grongri Gref.
That is my theory.
It could be some other events that might have taken place. We don't know.
Yeah, because I seriously believe that because Rongli was the first outbreak and from where it kind of jumped from the Gref camp into the civilian population, right? The movement of the virus, as you pointed out, was from till then, only returnees were testing positive. And some people were getting it even in the quarantine centers, right? This whole insanity of having two strangers quarantined in the same room. One tests positive, the other is bound to test positive.
Yeah.
We are digressing here, but I'm shocked that more noise is not being made by that second person. In all these cases, the second person testing positive should really be taking the department, the DC, and whoever organizes these things to task. How could you do this?
I only remember one case where a person had, I'm sure there were more, but in my memory, there was only one case where a person had tested positive, and a few days later, the person, his roommate in a quarantine center had tested positive.
And those roommates did not travel together, right? These are just
we don't
two
know.
strangers.
No,
these are two strangers who were put together, yes. I mean, no, there have been more than that. There have been more incidents than that. But again, I think there are some answers to be sought there as well. That where is this crazy, every second day they come up with these notifications claiming standard operating procedures, which I think IPR had this brilliantly funny full form of at one time. I mean, we all know it's standard operating procedure, but it was like some weird stuff, which just goes to show that no one really knows what these things mean. But the point being that it's inexcusable. The outbreaks in quarantine centers, for instance, right? We are talking here about paid quarantines. There have also been outbreaks in facility quarantines. Those also have to be explained. Did the people who were lodged there come with the virus, or did some of them actually contract it there? Come in contact with the virus there? And if that were the case, then the whole question of when you are ordering people to go into a quarantine facility, is it not your responsibility to also make sure that you make arrangements in such a way that I do not get the virus because I'm just staying in that facility? And it's not enough to say that people are careless, right? I don't think that just cuts it.
No, I just remembered there was also that Namchi incident, Namchi hospital, the TB ward and all. We have not been told how the virus got there also, right?
No, she's a contact. No, the nurse.
Yeah, the nurse is a contact.
Is a contact of someone who was at the funeral.
We have not been told how the Dentam girl got infected.
The one who had
a brain
surgery and things like that. Yeah. No, but we've brought in all these questions.
My theory is that the Dentam girl got it from the Namchi hospital because she was brought to the Namchi hospital and there she tested positive for, after a few days in the hospital, she tested positive for COVID.
No, it's very possible. And it's not about blaming anyone, right? Of course, hospitals, it's not just COVID that you get in hospitals, right? I mean, it's more or less established that you catch other illnesses also when you go to hospital, primarily for the fact that a lot of people with contagious diseases end up there, and people whose immune system has been compromised also end up in hospitals, and that will lead to infections, right? The point in all this, I think the point that we're trying to make with all this, when we say that we've not been told, is not because we want to know, right? It is not just out of mere inquisitiveness that we want to know these things, but because we think it is important for them to find out. It is very important.
We want to know so that we know that they know.
We want to know that they know, and more importantly, unless you know how the virus has jumped from an army camp to the civilian population, and when it jumped to the civilian population, it spread so fast and in such large numbers. Sikkim, I think, should count its blessings that most of its patients are asymptomatic. And even if they have symptoms, it's been mild. There's been one casualty, yes, which was very unfortunate. But beyond that, people have made pretty good recoveries. So you're just lucky. It's got nothing to do with your healthcare network, infrastructure. It has got nothing to do with how the DC is administrating the state or what the chief secretary is doing with the state task force. It's sheer luck, I think, or the basic physical composition of the people here, right? But why we want them to figure out these? Why is it important for them to figure out who brought the virus to Chanatar or to Mamring? Is because then you'll know how it reached that person. you'll know how the virus jumps communities, right? And then when you tell the people that, maybe the department knows, for all we know. I don't think they do. They know very little. But it's very important for that to be told to the lay community so that people can then take those precautions. Like right now, I think because of Mamring and Chanatar, the attendance at funerals is very controlled, I'm sure, out of people just taking precautions, right? Or even if they go, people are being careful. They are wearing their masks, they're sanitizing their hands, they're using their hand sanitizer very often. People are just being careful. So trust the people's selfish need to keep themselves safe by giving them this information. And your future protocols cannot be dictated by Delhi alone. Those have to be dictated by your realities and your situations. And for that, you need to know the details of every case. Like what level. I want them to have details like what level of exposure a particular person had. Right? You'll never know these exact things, but it is important for you to know.
Yeah. I was going to get into the importance of finding out where the outbreak has come from by mentioning this a series that I watched on Netflix. And I was telling you also the Salisbury poisoning.
Yeah.
I don't know, I think that's the title. But it is about the poisoning in Salisbury in England, where a nerve agent, where it was termed as a terrorist attack by Russia, where a British spy for who was in Russia had come back to England. I think he was spying for England in Russia. He was a Russian fellow, turncoat or whatever. So he had come back to England. Then he gets poisoned and all that, and then they find out that it's a nerve agent that has been Novichok, a nerve agent that has that poisoned that fellow and his daughter. And then it's like COVID, right? So the nerve agent, once it is there on some surface, can survive for 50 years or more.
Yeah, that's not like COVID.
No, I'm saying, that's worse than COVID. Yeah. I was telling you how I was like thankful that this is COVID and it's not a nerve agent. Yeah, but at the same time,
it's a chemical weapon.
So it just spreads. Like you touch it and then you touch something else. It will contaminate everything that you touch, right? If it's on you or if you have touched it and all that. And then by touch also you get infected, and then you will. It is a deadly chemical. So you will most probably die. But then in this case, the father and the daughter, I think,
who had been targeted,
the series does not really show whether they survive or not. But anyways, so the point is, the director of the public health department of that area is a woman.
And this is not even a state; it's probably just a county.
It's a small, Wiltshire or whatever that place is, and Salisbury is under that. So this woman is the health director of that area, and she is tasked with public safety, right? So ensuring that the chemical does not spread or whatever, and she does a really good job anyway. So her aim is to figure out how it got there, the nerve agent. How did these two people get poisoned, and how did it end up there in Salisbury? But what happens, as I think very similar to what is happening in Sikkim also, the bureaucracy, they are like, ho gaya, just solve it. These two people have not died. It's fine. Nobody else has been affected. Forget the case, right? But this woman is like really wants to get to the bottom of it, and she knows how important it is. She tries to explain, but they don't understand. They're like, forget it, ho gaya. Up now, it's been some days, some weeks, nothing else has happened. Forget it. Like, who's going? There's money involved. You need funds to investigate and all that. Figure out. She wants this large scale investigation and cleaning up of the area and all that. But they say, paisa nahi hai, nahi karna hai, whatever. And after I think 4 months, another 2 people get infected, and one of them dies. So apart from the Russian father and daughter, a police officer had also got infected. Thankfully, he also survives. But then after 4 months, when these 2 other people get... So most likely, it's not very clear in the series, but they get infected from the source. It is a perfume bottle which was carrying the nerve agent, and these 2 come across this bottle and use it as a perfume, and that's how they get infected, and one of them dies. So what I was kind of trying to say is, it is important to find out how it all began.
And it's not important, like I said, it's not because we are inquisitive and things like that. It is important because that is the only way you can decide what is advisable public conduct or what level of hygiene and safeties you need to follow.
Yeah, this is not.
Otherwise, it's like this crazy thing like cops start stopping people on two-wheelers and checking whether they have a mask.
Yeah, I forgot to mention, the Salisbury poisoning is not fiction. It's real. It happened in 2018.
Yes, it was all over the news.
Yeah, we know, whatever. So 2018 that happened. What I was saying is that it is like in Sikkim, right? Abhi to koi nahi mara hai. I mean, in Sikkim we have lost one person, but koi nahi mara hai, sab theek hai, chhod do. But then it ended up taking one life, in the end afterwards. So, like, we are just, like you said, we are just lucky till now that we've had just one casualty so far. And we have to be careful so that that number does not increase, right?
Let's just accept the fact that the number could increase, right? With so many infections, it's only a matter of time. Hopefully, we'll be proven wrong. But it's only, you've got to be prepared for that eventuality when someone will have more fatalities, right? You can't help it. When that one, and why I'm saying we should be prepared for that is because Sikkim was clearly not prepared for even that one fatality, right? The confusion that happened over the funeral, what protocols to follow, who's going to do what.
We have to talk about the stupor that the entire state went into.
That happened much later. That happened after the 100 cases or something.
Yeah, so that happened after the agriculture department employee was detected with COVID.
The people panicked. The government went into a stupor much later.
After a few days after that, when they connected it with the Chanatar Mamrin thing and it just started, then then the lockdown happened and the administration also went into lockdown. We didn't know what was happening for a week. I think it took them around a week, or a little more than a week, to come around. Anyway,
I think the bigger fatalities, of course, hopefully will not happen. They will probably happen. But what will be more worrying is if more people turn symptomatic.
Yeah.
Right? Because they will need constant medical care. And that will really stress your medical personnel, your health workers. And so far, that has not been the case. But, these numbers you're talking about, how many active cases do we have right now in Sikkim?
400 we don't know how many active cases we have.
We do know. We do know. The health secretary doesn't know. That's a different thing.
475,
right? 475, right? So there are 475 active cases. And imagine even if half of them were just running high fever. And you have all of them in medical facilities. It's not as if they're at home and you just give them paracetamol, right? There's very little medication you can provide them. But they will need much more medical attention than what you're currently capable of providing. I think just 200 symptomatic patients can also really stress things out here. So
they're already...
That is why you need to know. And then you have to have realistic, practical, and what really helps levels of standard operating procedures for everyone involved, from the lay citizens to your officials to your cops and everyone else. Otherwise, you're just collecting info from Delhi and saying, "Ab jo Delhi bol raha hai, wahi karte hain." Like all the questions that you've been asking, I think one of the questions that needs to be added there is that why are we now having such an outbreak at pharma companies? We've had a spike, right? You cannot just blame that on Mamring and Chanatar. There is only so many people who could have possibly attended those two funerals, right? So there have been outbreaks in pharma companies, maybe not huge numbers, but many of them have been sealed and sanitized. So you need to ask, is it the working condition that led to the spread, that facilitated the spreading? Or are you going to put the blame on some other aspect of some other reason? I think these are very important things for I think it is things like this that this much announced war room in the health in the hospital.
Yeah,
the
we have
department
not
was
been
supposed
told
to do.
what has happened to the war room that was supposed to come up at STNM, no?
Yeah.
And
I
what
think
it is supposed to do.
The world over, all the success stories, I mean, there are many factors that come in, but one of the very important one is statistics and the intelligent analysis of that statistics. Where it has failed is where you've shown no imagination, you've shown no understanding of local realities, and just, what is it, the word, tapered whatever Delhi is doing.
Copy-paste.
Delhi, I mean, center, right? Because that's not a very great informed decision making happening there either.
And like I was mentioning before to you, some of the countries around the world have already started preparing for the winter, where it is expected that the numbers might go up, and we don't know what is going to happen here, whether they have even thought about it, because winters here are also, we go through a proper winter, right?
Yeah,
it's not like...
Yeah, and I mean, yes. I mean, at one level, you got to learn to live with the virus, right?
Yeah, that
what
is
else can
there,
you do?
but preparation...
But yeah, you have to be prepared. I mean, that's your job. You have to be. I mean, you have to be at least aware of that eventuality.
And we'll now go into the collateral damage of COVID-19 in the state. We had carried a video feature on it on our Facebook page and YouTube channel, where we had our reporter Aaron Rai talk to some patients, cancer patients, and to the oncologist at STNM hospital to figure out what is happening with the cancer patients who need treatment in Sikkim, and because of the COVID scare, what effect it has had on their treatment. What we found out is obviously there was an effect, and therapy like radiotherapy, I don't know about chemotherapy, might have also been affected, because now a lot of cancer patients who were getting treatment outside have also returned. They are here and the numbers are high, and so there is some sort of backlog happening also. And the major issue...
There's a waiting list for
yeah,
radiation therapy, yeah.
The major issue was of radiation therapy, where we had first mentioned that a radiologist was missing, but it was not the case. It was not. There is a radiologist.
Nobody is missing.
Unavailable.
Not on station, yeah.
So, but it was not the radiologist. It was a radiotherapy special. I forgot what was the name.
Doesn't matter.
It was the safety officer. Or something.
I mean, it's simply like it was not the X-ray specialist. It was the cancer radiation therapy.
Safety officers. I know that much. Radiation safety officer.
Okay.
And medical physicist or something. Yeah, that kind of term was there. So that person is stranded in Kolkata, which is why they are not... I don't understand that, but that's the clarification we got, is that they are... which is why they are not being able to take up new cases. The old cases, they are being treated.
Yeah, because I mean, that's easy to understand, right? The old patients, their radiation protocol, or I don't know how these things work, but whatever dosage, exposure, all these things have already been decided. Whereas for new cases, you need the specialist around to decide what protocols to follow or what procedures to follow. And maybe that's why they cannot have new patients. But yeah, the lockdown, right? As much as COVID, it is the lockdown as well that has affected cancer treatment. And as much as it has affected cancer treatment, what is also worrying is that it is possibly also affecting cancer diagnosis, which means fewer people are now... For instance, you're not getting... very few people do that, but if you were into getting proper full body checkups or whatever, annual checkups done, that is not happening. People with mild symptoms that might have led to an early diagnosis of cancer are not going to hospital because of, in many cases, doctors themselves advising them not to come to hospital if it can be avoided. So that is happening all over the world. There's no surprise that it's happening in Sikkim as well. And we have the oncologist on record saying that yes, the average number of diagnoses has come down. The last lockdown of 2 weeks that we had, saw the worst fall in numbers, like people just didn't come because it was so strict, and everyone was so scared, from the administration to, I think, the doctors to the drivers to the patients themselves. So the numbers were very low, and that is a worry. It is worrying that we don't have the radio safety, whatever, on station as well. You've not had that person for 5 months. I mean, by now you should have figured it out. Like, there is no excuse, no acceptable excuse for this. It is almost at the same level of embarrassing delay in the opening of the dialysis facility at Gazing. Right? It was inaugurated
on 2nd July.
A month back. And it has still not, what is it, dilating patients?
And
the dialysis function is still not working.
It's not functioning, and yesterday the health secretary said you might have to wait another month or so.
No. He meant for people on the waiting list. The facility itself is now going to start any day. Right?
Okay.
But there are people on the waiting list. So they will be bringing 5 patients. Right? Those 5 patients will be in quarantine, tested for COVID, and then the procedure can begin. But I don't think it is good enough that you're bringing patients 5 at a time. I can't understand.
I can't understand.
You don't have to have exclusive access to the machine, right?
No, I can't understand how you can make a dialysis patient wait.
Exactly.
Kaise?
Or a cancer patient wait. How can you have a waiting list for radiation therapy?
कैसे होता है मेरे को समझ में नहीं आता है.
No, and how is it acceptable? My thing is like this should have been. So what is happening with see, the lockdown had its impact, right? The lockdown kept patients away. They were scared to go to hospital. They don't get diagnosed in time. They cannot afford the extremely high travel fares that are being demanded now because of the reduced number of passengers, everyone being careful, things like that. All of these reasons are there at one end, but at the administrative level, like, you have to be like, ab 5 mahine ho gaye yaar. We cannot keep getting excuses.
No, and this,
you're a specialty hospital. You've got a referral hospital in Sikkim, right? And to think that there are still situations where patients cannot get treatment or procedures that are required is wrong. And we talked cancer. It's obviously suffering. We talked about dialysis, which is also suffering. What about TB? Like, at what level are TB detections? How is the TB medication being administered or worked out? What are the solutions done for that? How are you keeping there's contact tracing with TB patients as well, right? You've got to keep track of how they're faring. That must be suffering. New cases of liver cirrhosis. I mean, that's not going away.
Yeah.
Right? Are enough of them being caught? Are they being treated in time? And it is neither COVID nor the lockdown that is really doing this.
Yeah.
It is just how useless your administration is. It is their complete failure to empathize with the people, to understand that they're not doing us a favor by being an officer. It's their job to deliver on all these other aspects as well. And you just don't have, Sikkim just doesn't have those officers, it seems.
Sad.
Depressing. Like, we got to go further degrees of it. I think it's downright depressing that this is the situation here.
No, and I think we've mentioned this. I don't know if we've mentioned this in our earlier previous podcast, but I was like, just now when you were talking about all this, I was thinking, because again, everything is concentrated in one officer or one power who cannot handle everything, right? It is. I don't think
that these people can handle even if one thing. But okay, let's say that overstretched. Okay, let's go with that.
It is impossible. So you need to delegate. You need to constitute different teams for different issues, for different this thing. I don't see that.
So I think what they end up doing is they'll create multiple committees. But all these committees will be headed by the same officer.
You have to give over power also, decentralize, especially in this situation. I've said that before also, like, forget about your stupid hierarchies and struggle, what power battles and egos and all that. अभी तो तुम दे दो ना, decentralize, give power to so that things move faster.
Yes.
You can't like everything, like the health secretary is looking after COVID care, whatever also, then ये TB, dialysis, ये सब.
No, all of them are separate wings, I'm sure.
Yeah, they have, but I'm saying I'm sure वही ना. Again, they'll have to signatures तो ऊपर से ही आना पड़ेगा ना.
No, and I don't think the problem is with the health department. I think the problem is that
I was just giving an example.
No. Because this is primarily a health crisis.
Yeah.
Like everything around it, boils down to the health crisis that you're facing. I think the problem is that this is where our country and our state
have collapsed.
Not collapsed, is not realizing. It's a health crisis being managed by the home department. Right? And you cannot tell me that, okay, only home has the disaster funds come to home department or whatever, and that is why the DC has to it. That's all. It doesn't make sense, right? Money can easily be transferred wherever it's required. So it is a health crisis. It has to be addressed with a health professional's outlook, right? People responsible for public safety, and we don't mean the traffic, we mean like health, public safety. Those specialists they need to be brought in, and all these other home department henchmen should be placed under them, and they should these officers who know the problem at hand and what are the best standard operating procedures to follow, they should be telling these guys, okay, now you issue this notification, you do this, quarantine that area, seal this area, close that area off, tell these people to behave. It cannot be like the police is working on its own, the DC is doing his own thing, the health department is then trying to figure out. And the funds, the emergency funds for COVID should be with the health department. We have seen that. They've opened many quarantine centers. They're providing nurses and doctors there. And their safety is now being compromised because of lack of funds probably, right? So it's just... And other collateral damage we were talking about is no one is yet talking about the fact that the people's ability to pay for medical care is also been compromised by 5 months of no jobs for a lot of people. There are so many people who've been rendered without an income, right? Many have been rendered jobless. That's a separate thing.
Nobody's talking about it now.
Many people have been left without incomes. Everyone talks about how will they pay the fees of their children or pay the rent and things like that, all of which are valid. Those are problems. Everybody is in the same boat with that. But you got to also be ready for the fact that a year down the line, because these people have not earned enough or anything for these 6 months, they will not be able to afford the emergency medical care that could have stopped a medical condition from becoming worse.
No, that...
बात भी नहीं हो रहा है.
वो तो सोचा भी नहीं होगा. I mean, like they don't have they are so caught up
because
with
the people who are going to be looking into these things and have the power to do something about them, have their insurance, have their government salaries, have their medical reimbursements. They don't even realize that not everybody lives this privileged life that they do.
So I think it's very simple, no? Just say like when you don't plan for something, then when that thing happens, then you're so caught up in figuring out how to deal with it that you forget about the future, right?
Yeah, and
so that is what is...
Yeah.
Like, abhi to they're just
that
grappling with
explains
the current situation.
That explains it. And that I would have even accepted as a justification 2 weeks.
Because we had a heads up of...
2 weeks into the whole scenario, right? 6 months, you should have become experts by now.
Yeah. Yeah.
But they've become experts at
goofing up. They're like every day. Anyway.
Catch a breather.
Yeah. It is sad that in all of this, we have misinformation, we have rumors, not really fake news, but misinformation, and that we had a lot of those cases in between, right? And I blame primarily the lack of proper communication from the authorities for all of that, because they are not providing proper information. कुछ तो लोग अपने आप बना रहे हैं और कुछ they are making mistakes because they don't have the proper information, no? So a lot of that happened also, and then you had this big fiasco on social media, where what the Chief Minister had said about how the public are to blame for the COVID spike, let's say, the big outbreaks, that became this huge
Talking
thing
point
on social media, and and those things, and I think that is the time when then the ruling government's, sorry, not the ruling government, the current government's spokespersons also came out in public. Finally, after, I don't know, some weeks of...
That was pointless chatter, I thought. I mean, everyone wasting their breath over it. But because in one of the meetings, the CM had mentioned that fake news is a problem, suddenly the departments became obsessed with it, and there were press releases, and there were, I don't know, everybody was talking about fake news and things like that. I don't think fake news is the biggest problem facing Sikkim.
Yeah.
Fake news is not even new to Sikkim, right? Or misinformation, or hyperventilation. And the present party in office should know that, right? Their entire political career in opposition was fueled by them blowing things out of proportion, and that's how they caught the eyeballs and the attention of the people, right?
Yeah.
So it is wrong. I mean, I'm not saying that it is right. Misinformation is wrong. Agreed. Does it happen? It happens all the time. Should you mistake WhatsApp forwards for fake news? No. WhatsApp forwards you cannot control. You'll always have this inquisitive aunt, inquisitive uncle, this hyper-paranoid cousin who will just be manufacturing information because
that
they think that you are...
That is fake news. No, WhatsApp forwards are fake news, not what is shared, not entirely what is shared on social media. Some of it is, most of it I think is not really fake news. It's just
misinformation or incomplete information, whatever. I don't. Yes, that should not happen in a time like this, even more so. But is that something I want officers in the government of Sikkim wasting even an hour on? No. Right? If you fall for fake news, it's your problem. You should know better. In a way.
Yeah.
And can you do anything about it? No, because you've not done anything about it so far. Except go after politically convenient targets.
Yeah.
Right? Where the real damage was done, you've done nothing. So let's not even pretend that you are serious about fake news, because every time, I'm telling you, every time a cop or a government officer, right, picks up a piece of fake news and says we need to investigate this, they will first check with their political masters, sir, isko pichadi janta hun, sir? Right? And they'll say, no, go easy on this one. And then you also say, okay, it's not such a big deal. So you're just doing this to earn brownie points, right? IP are holding this entire meeting about negative news and fake news. They're just earning brownie points. They know they're not going to achieve anything. So let them do that. But please do not lose focus of what is the real problem, which is the health of the people, their economic well-being, their financial prospects, the education of the children. No one talks about children. It's been 5 months and no one is talking about children. An education department cannot tell me that their online classes are delivering. That's a scam.
That is
right? That is a scam, not because I'm not saying scam because someone's making money. I'm saying a scam because it is achieving nothing.
No, I'll tell you.
And that is the case with private schools as well.
I don't want to tell you, but I might get into trouble. Anyway, so the thing is, all of that is fine what you said, that priorities are getting COVID patients well, getting them in hospitals, detecting them, blah, 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 all that. But information is also very important. Abhi to bola na humne starting mein, ki when you give out the right information, people will understand, they will follow they will try to do the right thing and all that. But information, it's coming out in bits and pieces, every time. So you have the administration, I think all times should have, but it doesn't. But at least during this time, I think even the administration, like the East District Administration, should have a spokesperson, right? Because even we feel guilty calling up the secretary or the DC who we think should be doing much more important jobs. than talking to every reporter who calls them up, right? It is understandable, and they have shown their whatever. They always say that I've been so busy and I've just spoken to this and itna call aata hai, I'm so busy, I don't have time. We understood. Appoint someone else as the spokesperson who can even give us a ek din late jawab do, but jawab do. Like, we can leave the question with the spokesperson. He will ask you later, whatever, you give the jawab later, but no, na. But right now it's like we don't know. Is this, I mean, I can understand, वही बोल रही हूँ ना कि I can understand they are busy, they should be busy at this time at least. And then you have like the health department, the health bulletin coming a day late, right?
No, it's 12 hours late.
12 hours late, which is a day late.
Okay, if your day has 12 hours.
Night cut ho gaya na?
Yeah.
So, no, what I'm saying is, everybody, not everybody, I've seen a lot of complaints about this, right? You have 12 ghante you have given to the people to make up fake news.
To speculate. To
speculate, because you're not giving up-to-date information.
Yeah.
And then you come and complain ki fake news ho raha hai, aisa mat kijiye and all that. Yeah. You are...
Let's not get started on fake news.
Okay. So, what I'm saying is... up-to-date information, real-time information. I don't understand why it is not possible. I don't understand why you cannot give even like, okay, just now 2 people have got tested positive from Arithang or whatever. Give it right now from your official social media page, right? Mm-hmm. And then at the end of the day, give us the roundup, right? That is fine. Why can't you do that? Aren't there enough employees? Like there are IEC officers and
yes, they could requisition the services of all these people who are so busy on WhatsApp groups forwarding fakes, and tell them, we'll give you the real news. You are such a good spreader of information. Spread the right word. They could easily do that. No, yeah, I mean, because numbers are something that can be updated real time, right? I think there is no problem with that. They should do it. I don't know why it should be kept a secret. The moment an information is confirmed and it's numbers and an area you announce it. Because people clearly are salivating for this kind of information, right? I don't think it's that important. But let's say, okay, yes, you give it out. And then you keep your briefings to answer questions. All these questions that rise throughout the day, right? Like the complaints of the people that they're not being tested early enough, complaints of health workers that they're being made to work too hard, and that different areas have got different work schedules, or all these string of questions we asked in the beginning, right? This one-way traffic of communication does not work.
It does not
because
work.
Then you talk gibberish and you get away with it. You can't even be called out or asked to explain or asked to correct yourself. So, yes, I mean, there are like... And we know, yes, if we make the effort and we reach out to the officers, they will talk to us. But if there was a format, if there was a schedule by which you could do it, everyone's life would have become easier.
Everybody, life needs to become easier at this time, right? वो जो officer है वो भी तो stressed है throughout the day, and जो people है वो भी they are like might contract COVID anytime and die probably. So like make life easier, no? जितना भी है.
Yeah.
I'm just joking.
You don't actually mean someone will die.
No, I'm just joking. I'm just saying, like, why can't we make each other's lives easier? I have a major beef with the health bulletin being in video format. I don't understand at all why you need to give statistics in video format. Who gives statistics in video format? I don't know. You give us a press release, yaar, kitta. Details also, I would prefer in press release of where the patient is from, how they contracted, everything. Then you have a special message to the public, you give that in video format. Absolutely thumbs up, right? You have you need to explain some goof up or explain some situation. You do, that is what video format is made for, not for statistics. I absolutely do not understand why statistics are being given in video format, and the media people have to go forward, backward, forward, back, place, pause, stop, and then like decipher, and it is there have been major goof ups, and it is understandable also कि होता है when you are talking, when you will say something and then you will forget that you said that, or you will make a mistake and all that, you will forget to correct it and all that. Every day such goof-ups happen. Understandable, give it in written. As everybody says, writing mein, written mein chahiye. So just give her a press release. It's problem solved. Yeah, or
the numbers, yes, the numbers and
is so easy.
The other details.
Yeah, where they are from, completely. How they contracted disease, how they COVID positive contact hai ki nahi hai. वो लिखने में क्या problem है? I absolutely don't understand.
I think let's not call it brilliant, but I think a much more effective way of communication would be, like you said, this list, this statistic, official statistic, works on 24-hour schedules, ready at 8 o'clock in the morning. By 9, give it in written, right? They have that chart ready before that.
Yeah.
But no, that chart is not enough. So just
chart
have
is not enough.
an additional page attached to it, which fleshes out some of the details and release it to the people, put it up on your Facebook page, give it to the media as well or whatever. And through the day, let's say till about 2 o'clock, invite queries from, let's not have an open house, let's just invite queries from the media. Tell the media till 2 o'clock all the queries you have about today's cases or about states' COVID preparedness through or policy level decisions or whatever. Send it by 2 o'clock. The evening bulletin
will answer those.
Right? I think that will be so much more effective.
I know.
So much more effective that would be, because, and talking about COVID, I think we're back to COVID. I thought we had moved on from this.
We will now. Anyways, please.
One of the problems really is that we are getting a lot of, Sikkim's entire COVID kind of handling has been explained to us by way of notifications and orders, telling the people do this, do that, do that. You can do this, you cannot do that, you can go here, you cannot go there, and all those things, right? Pandemic time, maybe it's required, maybe it's not. I don't think it is. But still, we are not being explained the policy engagement, right? And it's not enough to say that we have to do this properly, right? A policy engagement has to be much more effective than that. I want, for instance, the education minister to tell the education department that if I want the schools open in a week's time, what do we have to do? Go sit down with pandemic experts, go sit down with the doctors, sit down with the teachers, principals, see what will be required and check with these people whether they can deliver. I'm not saying open the schools. I'm saying at least begin that conversation, right? The education secretary on his own cannot decide whether he can open schools or not. He'll wait for Delhi to tell him, right? If Delhi tomorrow tells him to open schools and Sikkim is in the throes of another outbreak, they'll open the schools.
Yeah.
What is required is you talk to experts, you talk to the stakeholders, and you talk to people who have to deliver on ground and say, can we do this? Right? If we can't do this, okay, we'll wait till the time when fewer regulations are required or whatever. But at least begin that is policy engagement, right?
Yeah.
Where you're telling them do this. You cannot tell them, go online, very good, use IT. Like, who even listens to those lectures you are posting online? Right?
Yeah.
So I think that is the level that they have to engage in. Similarly for, the commerce and industries minister, whoever it is, telling his secretaries to find out how do we get factories working. Right? You talk to the experts, you talk to the health experts and the whatever else is required and tell me, kab tak possible hai? How much is possible? So at least you know that you're engaging at that level, right?
This... again, I thought I will not talk about it, but the online classes thing that we are also sharing on our page. At first, I thought maybe the person who is giving us is not doing a good job. I thought there must be a plan, there must be a timetable, there must be a schedule, there must be some logic behind. I was giving, I think, too much credit to the education department, sadly. I was thinking, ki kuch to strategy hoga na? Kuch,
why a particular lecture is coming at a particular time?
No, not like so.
Not that detailed either.
Yeah, very funny. So no, I was saying there must be some designing that must have happened, right? Ki ye chapter pehle, ye class 6 ka isme, class 12 ka isme, whatever. And I thought the person who was giving us was not doing a good job or was not like... didn't have the time or whatever, but it seems the department has not designed it at all. Like, even originally, we are sharing something that has already been shared actually. So even originally there was no schedule, there was no timetable. They were just recording, putting it, जो आए, जिसका आए, जो teacher आए, जौन से class का आए, they're just putting it like that. And I am amazed. Like, you're doing it, no? In the end, you're doing it. Do it properly, no? क्यों time waste कर रहे हो?
It's like this. I think that is the state response. By state, I don't mean the state government.
Like the education department, people need education, yeah? Then
I think that is like the state response. When I say state, I mean Sarkar, right? Center, state, all of these. Is they just want to have this pretense कि कुछ हो रहा है. So it's like your mask, right? They're making everyone wear a mask, ordering it, making it compulsory, telling everyone to wear the mask, which does nothing to stop the virus. These masks that we're wearing, it does not even keep dust out. But it's like, oh, the state is concerned for everyone's well-being, so I'll order you to wear a mask. You will wear a mask. So what if your face explodes in pimples and you have to smell your own stinky breath, right? You have to wear a mask because it gives you that false sense of security, right?
Yeah.
When people wear a mask, it's a subliminal messaging. You feel you are safer when you are not, right? Let's just accept it. It's not doing nothing, unless it is really doing nothing. Similarly with the online classes, right? It's achieving nothing, I think.
it's a waste.
Right?
It's so sad.
The only kids listening to it must be the Gyani, good Padaku kids who would have read the chapter on their own and still understood it.
No, I am irritated with
Is it reaching out to the other kids? Are we talking about what the kids are going through?
No, I am irritated with, sticking to this topic, I am irritated with the person behind the entire thing, right? The teacher तो आया ना, बेचारा उसने lecture दिया ना, ठीक है, whether that, but किया उसने अपना काम ना. But when you are packaging it in such a disorganized way, it's like becomes useless, because we have had comments saying that please tell us when, and I was thinking, like, I had already thought about it also, but then you don't, I mean, मैं कैसे बना? I am not education department. How am I supposed to decide which video goes when, and like I don't have the
which
entire
subject gets taught when?
Yeah, which like कैसे, how am I supposed to structure it? That's not my job. Or if you want me to do it, okay, I think I might do a better job than the education department. Give me money, यार, मैं करूँगी. Anyway, yeah, please go it.
No, I think that they're just fooling everyone and themselves, thinking that the online format will work in educating anyone.
As it is, right? Though.
And I'm not even getting to that larger discussion of whether even the schools are educating anyone, right? But at least the schools are giving this social experience to our kids, which you've taken away, right? So, my problem is they're not even talking kids. No one is talking about how are the kids faring at a policy level, right? They are more concerned about whether the pharma a separate notification needs to be taken out because I forgot to tell people that pharma companies can function.
Yeah.
Right? But they're not telling me whether a park can be, whether it's safe to go to a park with kids, whether it's okay. Of course, kids are going out and playing, right? No one is stopping them, but it is still not allowed. I want when you allow it, it tells me that you know what the kids are going through. 5 months and not a word on whether the kids can go out and play. That just goes to tell you what the kids are going through.
Yeah.
Or how they're treated.
No, when we discuss all this, even the education, about other departments as well, the system was already screwed up, right? Like everywhere else also, the COVID has exposed systems that were already in ruins. So even here, so when you talk about IT and all, वो नहीं हो सकता, 1 महीने में 2 महीने में भी नहीं हो सकता. They cannot suddenly set up everything, right? Yeah. So understood, ठीक है, वो तुम just for show do all these tamasha, but at least now also think about working on long term plans ki okay, इस बार तो we screwed up हो गया, maybe we should like plan ahead in the future if anything like this happens, or like just even if and nothing like this happens, just to mend what is in tatters right now, right? So उसकी तरफ थोड़ा सा अगर एक step ही लेंगे तो I think that will be an achievement. But
and you seriously expect people responsible for this tattering condition to then recognize things and make amends? I mean, like,
In an ideal world, yes, I would really like. I had when COVID-19 hit, I had this thing, right? Like
visions.
No, this क्या बोलते हैं meltdown kind of thing. Like मेरा तो oh God, मैं तो मर जाऊंगी अब 1-2 दिन में. Like क्या like खाओ पियो मौज करो क्यों वो करना and let me be nice to people. That kind of हुआ था थोड़ी देर.
You were so nice to people today in this podcast.
No, I'm saying so.
But then आँख खुल गया.
नहीं होता क्या ऐसे ऑफिसर लोगों का एडमिनिस्ट्रेशन का कि let me like okay I might contract, they might contract any time यार कोविड, they are like interacting with so many people. थोड़ा सा तो होना चाहिए ना कुछ अच्छा करके जाऊँ मैं जिंदगी.
Yeah, I mean COVID will probably not kill you even if you get it.
Might the person has
but
died.
maybe the nurses attending to you will collapse with dehydration because of the PPEs that they have to wear and stay in the window. We're just going all over there.
Anyway, so let's get away from COVID now and let's talk about Mr. Nawin Kiran Pradhan of the Sikkim Subject Committee, who created a stir kind of.
Yeah, after many attempts.
Media.
He's like a persistent guy hammering on this nail.
Yeah.
Like, go on, like, keep irritating.
But you need people like that.
And
also.
some days he gets this one story that catches everyone's attention.
Yes. So he had a problem with the MR. He had filed an RTI with the Department of Personnel, and he had found out in response that 1,600 people had been appointed on MR temporary basis.
Temporary basis, yeah. In the last 1 year.
In the last 1 year after under the SKM government. So he said, "ये तो बहुत गलत हो रहा है."
He didn't say anything.
No.
He said anything much later. It was, I think, that story was broken on his behalf by the SKM itself.
What are you saying?
Yes, isn't it? Okay. I'm not a big social media guy, but I think the sequence of events goes something like this. Mr. Jacob Khaling, the spokesperson for the SKM, had a video in which he said that we have come to know this, that he's got this information out, and that he now plans to find someone to file a PIL based on this information.
No.
That is how the story broke.
I know.
Yeah. You were in one of your COVID-induced isolations at that time, I think. So you missed it. This is how the story broke. It was Mr. Jacob Khaling who held a video conference, and he said, we've come to know that he has secured this information and he plans to go to the courts, and he's trying to find someone to kind of front as the petitioner and challenge these appointments.
No.
And it is not just these appointments, but even the OFOJ appointments that will come into question, and it will affect the futures and careers of this 1,600 people and those 20,000 that were hired earlier, and appealing to Mr. Nawin Kiran to not do something like this. That is how the story broke.
Okay. I had thought that Nawin Kiran had just broken the story. I mean, just talked about these 1,600 people कि ये तो गलत हो गया. This is a पेट पे लात of unemployed educated youth, because these people are hired without following proper recruitment process and all that. And then Jacob Khaling had come in the press conference saying that I thought he brought the OFOG into this debate. I thought
it doesn't matter.
Okay,
Let's
anyway,
forget it. The sequence doesn't matter.
Yeah. So this became a thing.
I don't know. I think it was essentially a thing between these two agencies.
But interesting.
I don't think it really touched the people.
No, what is interesting, according to what I've heard, even I didn't hear the entire. Like I can't stand these press conferences which go on for like half an hour and 1 hour. Anyway,
all press conferences go on that long. It is the job of the journalist to kind of distill the information out of it. But we've all become lazy and just broadcast the entire press conference.
Yeah, and time pass. Like cool is. Anyways, so what I heard from someone who had heard the entire thing is that Jacob Khaling for the first time requested Nawin Kiran Pradhan not to take this matter to court because it will affect the OFOJ employees also. And that was the interesting bit. That's it. कि request किया उसने.
No. He said like we are even willing to apologize if that is what he wants.
Yeah, that.
Apologize or request with folded hands, whatever.
हाँ वही तो.
Whatever. Yeah, it's a crazy one. I think Sikkim has to grow out of this situation where you do something wrong, and then when you get called out, then you play this whole panchayat role of everyone trying to kind of do mandvali and kind of settle the matter.
Yeah, and Nawin Kiran
because
came up
then-
with a statement later after that saying that I have never talked about OFOJ, I am only talking about the 1600. वो भी बोला उसने.
Yeah, no, it's fine. It's fine. You don't need to. But my question would be then why not?
वही तो.
Right? If you got problems with out of turn appointments, then why just these 1600 and when there is this bigger
It's-
lot of.
yeah, it's
so
all
this,
messed up, yeah.
That is not what is for me really the issue here. For me, it's what it is reflective of, and that is the fact that we do something wrong or we do something that is improper, not outright wrong, not criminally wrong or whatever, and then you get called out, and then you say, "Yeah, don't make a noise about it. Now it's done, and so many people will be hurt and so many people will be upset." I think when it comes to government's functioning, these emotions have to be kept out in a way, and it should be, is it correct or is it wrong?
यहाँ पे तो खदा लगा के सब solve हो जाता है.
Yeah, khada laga ke solve ho jata hai. Like that, no, and that's a cultural thing, right?
Yeah.
Which is fine in your personal interactions and relationships, but when it comes to governance, government's decisions, how government responds to situations, it has to be more objective.
Obviously, but it will take some time for that. No?
Yeah, so I think this issue is basically that for me. I think people also should not look at it as ki someone is going after these 1600 people and their jobs. Appointing people on temporary basis is not something new. It has happened even after it has been officially banned, and it will continue to happen.
Yes.
At one level, I feel that you need to have this system in place as well for genuine cases, but they abuse it so much that wo genuine cases mein you're left with a situation where you're understaffed, like I think is the case with the health workers right now.
The
But-
takeaway is that all political parties are same, and whoever comes to power doesn't matter. These things will continue to happen.
Yeah, there's some practices that are
Yeah.
kind of worked into the whole system. That is how they'll always be.
Yeah.
You'll be giving out favors, you'll be settling scores. So there's no surprises there.
But the bigger news.
Doesn't make it right though.
Yeah, it doesn't make
Not
it right.
endorsing
Are they?
any of it.
Big news. Big news. Another big news. Not news. Big halla. This discussion was about the appointment of Advocate Sudesh Joshi as the additional Advocate General of Sikkim. We already have an additional Advocate General, Dr.
No.
Doma. Is she additional advocate?
She is
She is.
additional advocate general, yeah.
So then it's not like she's
No,
not
but that's the
replaced.
whole idea behind additional. You have more than one additional secretary.
Additional. So,
So
but this created a lot of halla ruckus because a lot of these groups like Nawin Kiran also and Pasang Sherpa also
Everybody.
and
Everybody in the
everybody else
opposition.
in the opposition, they said, how can you appoint Mr. Joshi as the additional advocate general, because he has said nasty things about the Nepali speaking community in the past, right?
in a petition to which he's party or was party to, yeah.
That is the basic thing.
Yeah.
And then everybody is now releasing press releases, sending press releases ki we want the state government to cancel the appointment. Is that possible?
Of course it's possible. If the government appointed him, the government can remove him.
No, I'm saying like,
but
will the government do it?
Will the government do it? I won't be surprised if they do it.
Because they've always been...
Because it's got a communal color now, right?
Yeah.
It's a communal color, not in the very negative way, but a communal color because a particular community is feeling wronged. That a person who has been party to some very nasty things that have been said about them in an official petition in the Supreme Court has now been given this top position. They have a point when they say that if he indeed is involved with that, if he stands behind those statements, and then he is going to be representing the state in a lot of cases that will involve political and social rights of people. I don't trust his sensibilities to do a good job.
We haven't given. So he is party in a case about income tax exemption for old settlers of Sikkim, which is in the Supreme Court.
Yeah.
So he's a party in that case.
He was. I think
was.
he's withdrawn his name, or maybe he stepped out of it or
anyways.
whatever. I think even the statement attributed to them has been withdrawn from their petition, right? In which they had sent some really horrendous offensive, right? Offensive things about the community was said there. That has probably been withdrawn because I think that also happened many years back. But people have the right, yes, I think people have all the right to say that they're not happy with this appointment and that they do not feel that their legal interests as citizens of the state will be best served by this person who has an expressed position on their rights, right? So they have a point in doing that. The government has all the right to appoint anyone it wants. To that post, and it's an additional post. They can even appoint 2 more if they want. I mean, if they have the budget for it. Yes, that's there. And I don't know, is this uproar or protest against his appointment down to the people? Or is it just the leaders, like always, who have a position or a take on it? Leaders do speak for the people. Not always the case in Sikkim, but normally that is the case you go with.
Yeah.
So it's everybody is doing what they have the right to do. People have the right to protest. Leaders have the right to criticize, demand. They're doing that, and government have the right to appoint him. I'm also surprised that the government, if the government claims that this caught them by surprise, I'm appalled because they should have known what they were getting into when they were appointing him. Now I hope, right, and this is where public transparency comes in. I want the government to come out with a statement, right? It doesn't matter whether they down the line remove him or not, right? To now come out with a statement in which they explain to the people why he makes a good candidate for additional advocate general.
Never going to happen.
No, they should. They should say that these are the reasons we got him. These are the reasons we need him.
I know.
They should do that. I think they should do that. And if tomorrow they remove him from that post, at that time also they should explain why these virtues that he had were cancelled out by this public criticism that you faced for the appointment. Right? And that is the only way we can get some semblance of accountability.
Yeah.
That will be a nice experiment. Comes at Sudesh Joshi's cost, but it'll be nice if with this one experience we got to see all of these things happen.
Yep. So, I think it's time to end the podcast, which has gone on for a pretty long time today. And
I've almost forgotten how podcasts are done. It's been so long.
Really?
It's been a while, no?
Not really.
I think at least 3 weeks, maybe a month. I don't know.
Would you like to end the podcast on with a joke or something?
Like seriously, crack a joke.
No, a funny incident, a funny news piece.
Joke is so much better.
Okay, forget it. But we would like to end the podcast with a mention of all the people who have showered love on the podcast.
3 comments. Like doesn't qualify as all the people who showered love on the podcast. But anyway, let's take it as that.
I think it's 4.
Okay. Yeah, that makes it really big.
Yeah, so, yeah. And we completed 4 years, as in not the podcast, the Summit Times completed 4 years in the news business.
Yeah.
On 5th August. And...
we were surprised by the number of people who've noticed the podcast.
Yeah. And also for the first hour news wrap of morning.
Which is also surprising.
Yeah.
Because these are 2 things that are least watched on our Facebook page. But still.
And we hope to continue. And I think very soon we'll be celebrating our podcast anniversary also, no? I don't know now when we started also.
It's very easy. You just go to the first podcast.
During the winter. I think it is coming, our anniversary also.
Like what? 1 year, 2 years, 3 years?
1 year.
I think we've been at it for more than a year.
Okay. We'll have to check.
2?
And celebrate a belated anniversary.
Yeah.
Anyway.
There's no way of... I'm sure we can find out when we started.
No, yeah. We have YouTube and I think we have that.
Okay, when it was uploaded. I think we should do that. Next podcast, whenever
we
it comes.
Reveal.
Yeah.
When the Sikkim podcast started.
Yeah, that'll be nice.
Alright, on that note, Thank you very much for tuning in, and do check out our YouTube channel and on in whatever podcast platform that you listen to it. Give us a like, give us a thumbs up.
Subscribe.
Give it a like. Oh, give it a like, give it a thumbs up, and a subscribe.
Yeah. Can they subscribe?
Huh?
Can people subscribe to the podcast?
Yeah, of course.
Okay. That's how little I know about these platforms.
Yeah.
Yes.
All right.
Thank you for tuning in.
Ta-da!